First of all, vasectomy is considered to be a permanent form of sterilization, so it's intended to be something that's a lifelong choice. And so when people come in to have a vasectomy consult, that's the first thing we talk about. The first thing we talk about is where are they at in family planning, and are they sure? And if they're part of a marriage or if they're part of a relationship, that are both the members of the relationship also sure, because oftentimes that can cause a little bit of trouble. Vasectomy has about a 1 in 2,000 failure rate, which again makes it the most effective form of birth control that we know of. It is a simple outpatient procedure that's done in the doctor's office. The procedure takes anywhere between 15 minutes and a half an hour, depending on kind of how difficult it is to get the vas deferens isolated. But ultimately, it's also as close to pain-free as it can be. In my office, we use a system called a needleless and scalpelless vasectomy, which means we have a jet injector, which actually uses air to inject the local anesthesia instead of a needle. And so for us, I don't utilize a needle and we don't utilize a scalpel. And so it's just about as close to pain-free as it can get. The recovery for a vasectomy typically will run anywhere between 3 to 5 days of having some discomfort, and then I tell people they need to monitor their activity for about 2 weeks. I usually will tell people that for the first 24 to 48 hours, a little bit of ice and a remote control. After the first 24 to 48 hours, you can go back to all your normal activity, with the exception of doing anything that's overly vigorous. Anything overly vigorous for about a week or two. What's called a scrotal hematoma, or a small blood clot in the scrotum, can develop. This happens in about 3 to 5% of men. In that 3 to 5% of men, it spontaneously will go away on its own, but it can take up to 2 to 3 weeks before it goes away on its own. The other complication that we see frequently, and we don't even really list this as a complication because it can happen in up to 25% of men, is that you can actually have a little bit of a leak of sperm from the cut end of the vas deferens, and your body will actually react to that by putting a wall around it, something called a sperm granuloma. It can be uncomfortable for a week or two, but then after that, it's not uncomfortable, and there's just a small lump that's noted in the scrotum that initially is a little bit tender, but then the tenderness goes away. There are a certain percentage of people that will change their mind and decide that they want to have additions to the family. And with that being the case, there are options for reversing vasectomy. The important thing that needs to be known about reversing a vasectomy is that, number one, it's an expensive procedure that's not covered by insurance plans because it's considered to be a personal choice. If you do a reversal inside of 10 years, then the success rate can be as high as 70%. What everybody who has a vasectomy needs to know is that there's a distinct possibility that after a vasectomy, even with a reversal, that they may still be sterile. But there are other ways of being able to actually achieve a pregnancy, although it might not be natural pregnancy. With the use of in vitro fertilization and some other techniques, sperm can be harvested to be used for artificial reproductive techniques, but that's not necessarily a natural conception. I think the important thing is that people are aware that a vasectomy is much, much less invasive, fewer complications, and even more effective than the alternative for a couple, which is tubal ligation. You know, the other thing that men need to know, and one of the things that men really kind of get concerned about because they hear from their buddies or they hear from bad information, is what are some of the long-term effects of a vasectomy. There is a myth or a rumor out there that vasectomy can increase your risk for prostate cancer. Absolutely not true. There's also the concern that men have that they'll have less of that kind of sense of being a man. There's absolutely no risk for developing erectile dysfunction after a vasectomy, and there is no risk for losing testosterone after a vasectomy. All the hormones, all the patterns, all the hormone levels remain unchanged after a vasectomy.